Some hospitals do overcharge for routine procedures, costing patients thousands of dollars, and our healthcare system adds up to billions of dollars being spent. So we're digging deeper now on the issue with Richard Clarke. He's the president and CEO of Healthcare Financial Management Association in Chicago. And, of course, we're joined again by Elizabeth Cohen, our senior medical correspondent from Atlanta as well. Thanks to both of you. Richard, let me start with you. Your take on Elizabeth's piece when she basically went shopping and saw differences to the tune of thousands of dollars for basically the same procedure. What about that huge discrepancy?
Yeah, it's very frustrating for anyone who's trying to understand what their responsibility is for a hospital bill. And I can go through the details of why it would make sense to me, but I know it's very difficult for the average consumer to understand why is there such a difference in these prices.
And so you talk about how it does sort of, I guess, add up to making sense, but let's just try to simplify it a little bit for people watching and not understanding this. Do hospitals charge more to cover the cost of uninsured patients, let's say, that show up in emergency rooms, or do they charge more for certain things because they know they're losing money elsewhere?
Yes, all of those. I mean, on the average, for example, a hospital makes about 4 cents on every dollar that they charge, so it's not going into profit. What it does do is it compensates for the fact that the government, the Medicare and Medicaid programs, tend to underpay hospitals. Hospitals also have charity care patients and uninsured patients who don't pay anything. So the mix of payers, the percentage of Medicare and Medicaid, the percentage of uninsured patients have an influence on what a hospital will charge.
And Elizabeth, in your reporting, not only did you find these wild fluctuations in the cost of similar procedures, but also you pointed out yesterday that example where a patient who was only in the ER for a couple of hours was charged for 41 bags of saline. If they hadn't looked at that on their medical bill, they wouldn't have even noticed. So, what do people do about this?
Right. What you need to do about it is get an itemized bill so that you can see, gee, what am I being charged for, and did I use all of this? And in answer to the question that you asked a minute ago, Kiran, I think it's important to recognize that sometimes hospitals charge a lot because they can. I mean, if a hospital can get $10,000 for laparoscopic knee surgery, they're going to charge that much. It's like any other law of economics. If they can get that much money, they're going to charge it.
Richard, that's another question as well that Elizabeth brought up yesterday. She talked about the state of New Hampshire where there is an easier process. And in some cases, you can look on the Internet to find out how much procedures are going to charge. But in many cases, patients actually cannot find out how much a procedure costs or how much their total bill will be, especially ahead of time. Should there be more transparency when it comes to what we're paying for and why?
Absolutely. Hospitals are working on trying to improve their systems so that they can give estimates as to what something will cost. One of the challenges, of course, is a patient may call and say, well, I need a simple CAT scan, for example, a CT scan. Well, does that CAT scan have contrast with it, which is a very expensive media, or is it without contrast? They come in and say they need a colonoscopy. Is there a possibility that there may be polyps found and therefore removal of the polyps becomes part of the procedure? So actually estimating what the cost will be depends on what the condition of the patient is and a whole series of other issues. Having said that, hospitals are really working hard at trying to develop systems where they can give estimates on pretty common procedures. And a colonoscopy is a pretty common procedure.
And Elizabeth, it's interesting, there are some states that do try to do this now. In fact, the state of Maryland actually regulates hospital prices and has done this before, so it's sort of just a flat 20% over what the cost, I believe it is, whereas in some cases it could be 102% over the cost of the actual procedure. Is that something that other states should be looking at as well? Is there a way to find out whether or not that would make sense for certain states and perhaps even sometime down the road on the federal level?
You know what, there are other states that are looking to follow that Maryland model. Maryland's been doing it for 10 years. They basically, to a certain extent, tell hospitals what they can charge for certain procedures. And you can charge more if you're in a more expensive area or if you have higher operating costs. And it's actually, a lot of people say it's worked relatively well. They say Maryland hospitals actually have a higher profit margin than hospitals in other states. So other states are looking to see if that would work for them.
Interesting stuff. Richard Clarke as well as Elizabeth Cohen, thanks to both of you for your insight today. We appreciate it.
Okay, Kiran, and when we come back...